Jeremiah, screen share. So where did we stop? Okay. So this is the period of clinical latency. So take 10 years. Okay. So the half-life of the virus plasma is about 6 hours. And the virus life cycle, okay, from the time of infection, okay, to the production of new virus averages around 2 to 2.6 days. So the CD4 lymphocyte is the major target. Okay, so the major target of the HIV are the CD4, but it also targets the monocytes and the macrophages. Okay, so our immune per se, okay, your immune system. So this is an example. Once the HIV gets entered into the cell, our body, okay, it is recognized by the dendritic cells. Then the dendritic cells present the antigen, okay. Then the dendritic cells present the antigen to the CD4. Okay, but what will happen is, okay, the HIV inside the CD4 replicates. Okay, it replicates, replicates, and replicates. It goes into the lymphatic tissues. From the lymphatic tissues, it gets out of the venous circulation. It goes into the blood. Okay, it goes into the blood, and HIV can be cleared by the immune once infection is established. So you develop antibodies, and it undergoes what we call clinical latency. It goes into the lymph nodes. Once you have an active viral or bacterial infection, the CD4, the virus keeps on replicating inside the lymph nodes. And once they are in, marami na sa lymphatic tissues, okay, they get out of the lymphatic tissues and they are seeded to the different organs, okay, via your monocytes. Okay? So, ganun kumakalat yung HIV. So viral diversity studies have shown that in most cases of sexual transmission, a single HIV variant establishes a new infection. So early infection, viral sequences are quite homogeneous, but because rapid viral proliferation and the inherent errors rate, okay, HIV reverse transcriptase quasi-species virus accumulate. So estimated that every nucleotide of HIV genome probably mutates on a daily basis. Mabilis sila mag-mutate. Okay? So Syme said, eventually, if the patient has HIV, okay, develop a constitutional symptoms. Okay? Constitutional symptoms like fever, headache, body malaise, okay? And up to the patient develops what we call opportunistic infections or even develop tumors. Okay, if the virus is very, very high in the blood, okay, they can be readily detectable in the plasma during the advanced stage of infection. So many patients in us come to us, okay, in a full-blown AIDS na, stage 1, stage 3 AIDS. Okay, so if they are found or they are diagnosed late stage, okay, usually the HIV becomes more virulent. Okay, virulent is that they destroy tissues, cytopathic. Okay, cytopathic. So once they are diagnosed late, they are more virulent. Okay, that's why if you have an HIV should be diagnosed early. Okay, so that they are given early treatment. Okay, to prevent such opportunistic infections. Okay. So this is your CD4. This is the CD4. You see this GP120. This GP120 attaches to the CD4 receptor. Okay, attaches to the CXCR4 and attaches to the CCR5. Once they attach, they fuses to the envelope, okay, to the membrane. And once they fuse to the membrane, they get enter. They enter into the entry into the cell, and they release the RNA and they release the enzymes necessary for the transcription. Okay, so they infect primarily the CD4. And what are the importance of this CD4? The CD4 is responsible, okay, for our protecting our body against infection. Okay, so this effect include CD4 activates the macrophages. Okay, it activates cytotoxic T cells. It activates natural killer cells. It activates the B cells to produce antibodies. But what happens if they destroy the CD4? So now want to activate all of this system, all of these immune cells. So the patient become immunodeficient. Okay? So para siyang pinaka-leader, okay, ng immune system. At any given time, only small fraction of CD4 cells are productively infected. So many infected T cells are killed. So T cells are killed. Okay? So once they are killed, no one to activate all of our immune system. So the patient eventually, okay, becomes or depleted, okay, and easy, okay, opportunistic infection sets in. Okay, so less than 1 cell per million resting CD4 cells harbor the latent HIV provirus, okay, because of successful antiretroviral therapy. So even after 10 years of treatment, patients show very little change in the size of a latent HIV. So meaning even if you are treating patient with HIV, okay, the virus, okay, persists. Okay, the virus persists in the lymph nodes, okay, or inside the monocytes. Okay, within the lymph nodes, but inside the monocytes. Okay, they are the reservoir. Okay, because latent reservoir of infected memory cells decay very, very slowly. Okay, so when exposed to antigen, the HIV, okay, the drug therapy is discontinued. For example, okay, if you discontinue treatment for HIV, okay, you discontinue, the memory cells become activated and release the infectious viruses. So you have no right to stop your medication, even if your CD4 is already high. Okay, so because it may lead to what's called drug insensitive or drug resistance. What about monocyte and macrophages? So as I've said, HIV enters into the monocyte. Okay, once they enter into the monocyte, okay, they get into the circulation. Okay, so certain subset of monocyte express the CD4 surfaces antigen and therefore bind to the envelope of HIV. So they can bind. So the HIV co-receptors like the on the monocyte and macrophages, okay, is the CCR5 chemokine receptors. So once they are in the monocyte, they may circulate into the brain. Okay? So they may circulate in the brain and the patient may develop neuropsychiatric manifestation associated with HIV kasi napunta sa brain. So bata pa lang may HIV dementia, 24 years old may HIV dementia. Okay? Imagine dapat ang dementia elderly. Okay? So magtataka ka. Why? Okay? Probably the patient might have an AIDS at an early age. Okay? So it is believed that monocytes and macrophages serve as a major, you see, it serves as a major reservoir for HIV in the body. Okay? So unlike the CD4, the monocyte is relatively refractory. So meaning, di ba, your HIV gets inside the CD4. They replicate inside the CD4. Okay? But they will destroy the CD4. Okay, in the case of monocyte, they get inside the monocyte, but they will not destroy the monocyte. They hide inside the monocyte so that they cannot be recognized by our antibodies. Okay, so they make the monocyte as the reservoir. Okay, so this cell but can be transported into various organs. Okay, so parang transport medium, vehicle to get out to go to the different organs through your monocytes. So infected macrophages may continue to produce virus for a long period of time. So once the monocyte gets out of the circulation, it becomes macrophages. So once inside the macrophages, okay, they produce virus for a long period of time. So they actively divide inside the macrophages. Okay, so this is where, okay, so your HIV gets inside the lymphatic tissues, okay, so the different, that's why you see patients with persistent generalized lymphadenopathy, ang lalaki ng kanilang kulani dito sa leeg, sa kilikili, sa singit, okay, so lymphoid organs play a central role in HIV infection because there are a lot of lymphocytes and their favorite cells are the lymphocytes. Okay, it is in the lymphoid organs that the specific immune response are generated. Yeah, kasi there are a lot of lymphocytes in your lymphatic tissues. Yeah. Okay, so you have to remember, okay, that during HIV, there is also co-infection with other viruses, with other bacteria, like Mycobacterium tuberculosis. So that's why if a 20-year-old is diagnosed with tuberculosis, okay, you have to screen them for HIV because Philippines is endemic country for tuberculosis. You should not develop tuberculosis in a young age. Adolescent, may HIV, then you have to entertain HIV because pwedeng kakatampal na ng HIV. That's why the WHO recommends if you have tuberculosis, you have to be screened for HIV. Okay, so because if you have an HIV, it increases the risk of getting TB as much as 20-fold. Taas, no? So other concomitant viral infection, if you have HIV, you can get cytomegalovirus. Okay, CMV, cytomegalovirus. I have a patient, 34 years old, beautician, okay, unable to see yung right eye. I referred him to a ophthalmologist diagnosed with cytomegalovirus retinitis because of HIV. Herpes simplex, hepatitis B. They may serve as a cofactors of HIV or cofactors for AIDS, because they are also sexually transmitted. Hepatitis C is very, very high, especially in the United States. Patients with HIV co-infected with hepatitis C. So there is co-infection with other viruses. So these are the symptoms of your acute HIV infection. Very, very non-specific. After 10 years, it may lead to what? AIDS. Okay? So it may affect the central, the lungs, the skin, and the esophagus. Okay? So lungs, fungal pneumonia. Okay, encephalitis, meningitis. So these are AIDS, okay, symptoms of AIDS. Okay, this is the viral load, very important. Viral load is the measurement how, okay, many, okay, the values of virus in the blood. Okay, so if you have 10 to the 6 virus in the blood, you may develop AIDS in 62% in time, 5 years after. If 10 to the 5th or 10 to the 4th, okay, or 10 to the 5th, you may develop AIDS in 49%. Okay, 10 to the 4th, 26%. If you have a low viral load, you may develop AIDS, okay, only 8%. Okay, so what I'm telling is the higher the viral load, you may develop earlier opportunistic infection. Yeah. Okay, so the plasma viral load appears to be the best predictor of long-term clinical outcome. Okay, so your viral load measurement are critical element in assessing effectiveness of antiretroviral therapy. So I have to measure your viral load every 1 year, for example. Okay, so if your viral load decreases, so meaning that I am giving an effective therapy and you are religiously taking your antiretroviral drugs, your CD4 are the best predictor of short-term risk of developing an opportunistic diseases. Okay, CD4. Okay, so what about pediatric patient with AIDS? So patient with AIDS and young, okay, so children 2 years old, 4 years old na may AIDS, they progress rapidly. In 2 years, without treatment, they may die. So the progression of HIV in AIDS to HIV to AIDS among children is very, very fast. Okay, in a matter of 2 years, they may develop opportunistic infection because their immune system has not developed at the time of primary infection. These are the symptoms of your HIV among pediatric patients: pneumonia, candidiasis, wasting, and the like. Okay, so these are your symptoms of your HIV among children. Okay, so viral RNA are generally low at birth, suggesting infection acquired close to the time. So RNA levels rise rapidly within the first 2 months of life and are followed by slow decline until the age of 24 months, suggesting that the immune system has difficulty containing the infection. Okay, so what are the neurologic diseases or manifestations of patients with HIV? Okay, so you have encephalitis, meningitis, peripheral neuropathy, AIDS dementia. 30 years old may AIDS dementia. So 25 to 65% of patients is characterized by poor memory, inability to concentrate, psychomotor retardation, and behavioral changes. Okay? Diba meron ding receptor sa neurons kasi for HIV. Okay? So other neurologic diseases associated with infection are toxoplasmosis, especially coming from cat litters. That's why patients with HIV should not take care of cats because contaminated with Toxoplasma gondii. Cryptococcosis, they may develop meningitis secondary to fungal coming from bird droppings. Okay, JC virus, okay, it will destroy the myelin sheath of the brain. Okay, and the mean survival from the onset of severe dementia is usually less than 6 months. Okay, sorry, I just have to answer this call. Hello? Yes, ma'am, yes, ma'am.
Excuse me po, Doc. Nakamute po ata.
Okay, so these are your opportunistic infections. So please read on this. Yeah, yeah. Opportunistic infections. You may develop these 10 years, okay, from the HIV infection. So these are your pediatric neurologic diseases. Okay, yeah. And these are the levels of CD4 where you acquire infection. If it's less than 500, you may develop these infections. Opportunistic infection. If it's less than 200, very common, pneumocystis jirovecii pneumonia or pneumocystis carinii. Candidiasis, less than 200. If it's less than 100, you may develop toxoplasmosis. And if it's less than 50, you may develop CMV retinitis. My patient with CMV retinitis, CD4 only is 17. 17 should be above 500. That's the normal. Okay, these are cancer cells, cancer tumors that the patient may also develop with HIV, Kaposi, okay, angioblood tumors, angiovascular tumors, cervical cancer, anogenital, kasi may warts, especially men having sex with men through anal contacts, Epstein-Barr, developing Burkitt's lymphoma. Okay, so this is a summary of your tumor among HIV patients. So ang hirap ng HIV because they may develop a lot of diseases. Okay, so immunity. Okay, so most infected individuals develop neutralizing antibodies against HIV directed against the envelope glycoprotein. So even though they develop antibodies, the virus still lingers in the body. Okay, so hindi mo na siya matatanggal. Okay, so you can isolate the virus through culture. Okay, you can also determine the patient if it's an HIV through your enzyme immunoassay. So there is a change in color here. Okay, so this is the enzyme immunoassay. Antibodies to the HIV proteins, okay, through the use of a specific molecular weight can be detected. So antibodies to the P24 or envelope GP1, GP120, GP are commonly detected, okay, through the use of your enzyme immunoassay. Okay, so these are antibodies that can be detected during the early, during 4 to 6 weeks after infection. Okay, antibodies against GP. So if you develop antibodies, you can no longer see this antigen. So unang makikita yung antigen, then of course followed by antibodies. So these antibodies, okay, to HIV persists for a long period of time. Yeah. Okay, so there is also simple finger stick testing procedure. So you can buy over the counter, mercury drug, meron sila. Okay, so just prick, then add buffer. Okay, wait for several minutes, 20 minutes. If there is a double line there, then you are reactive. So once you are reactive, go to the treatment hub. Okay, we want your blood to undergo confirmatory test through your Western blot testing. So we will send a specimen to ITRMC or San Lazaro Hospital to confirm if you really indeed have an HIV. Okay, so we detect antigen through your antigen assays such as the RT-PCR, DNA, or the bDNA tests are commonly used to detect viral DNA in clinical specimen. So these are your antigens. So go over this, how reading. These are your reading assignments. Okay, ito, summary na ng spectrum of HIV. So HIV diagnosis by antigen antibody, you have AIA, rapid test, Western blot. This is the confirmatory test. Chemiluminescent immunoassay, immunofluorescent, line immuno. Sa children, early diagnosis in infant, we make use of your P24. Okay, initiation and monitoring of your treatment for HIV, CD4, and HIV-RD. Okay, so about a registry in the Philippines. So 2011, 6 cases per day. 6 individuals, 6 persons per day. 2014, 16 per day. 2016, 25 HIV per day. 2019, 35 patients per day. During the pandemic, bumaba. 21 individuals per day diagnosed with HIV. Among diagnosed with HIV, highest 60% male to male dito sa Philippines. Male to male. Sex. Okay? 22% sex with both male. Okay, male and females. Okay, male, female sex, about 17%. Mother to child, less than 1%. Okay, highest is among the National Capital Region, 37%. Okay, 4A, 21%. And Region 3, 19%. Yeah. Age registry in the Philippines. Okay, so highest age among with HIV, 25 to 34 years old. Yeah. See? 35 to 49, 18%. 2015 to 24, mataas din, 14%. Okay? So, because children are allowed to experiment. Adolescents. So, the global impact of HIV, 38 million people worldwide are currently living with HIV or virus. So, this is how the transmission, unprotected sexual act, okay, mother to baby, sharing contaminated needles, and unscreened blood. But of course, we screen na lang mga blood donors for HIV. Okay, so the presence of sexually transmitted disease such as syphilis, gonorrhea. If you have a sexually transmitted disease, the transmission of HIV is 100-fold higher because of the breach in the mucosa already. Okay, so mother to infant rates from 13 to 40% in untreated women. Okay, women. So infants can become infected in utero during the birth process. Okay, in the absence of breastfeeding, 30% of infectious mother in utero and 70% during delivery. Okay, so data indicates that from 1/3 to 1/2 of perinatal HIV infection in Africa are due to breastfeeding. So high maternal viral load are risk for transmission. So meaning, mother who is not taking antiretroviral therapy gave birth, okay, and the viral load is very high, she must not breastfeed. Only mother with a very low viral load, okay, should be allowed to breastfeed. Okay, and she can deliver the baby through vaginal if the viral load is very, very low. Okay, but of course, preferably CS. Kung mababa naman yung viral load, pwede naman ng spontaneous delivery. Now, if you have a patient with HIV, okay, and you prick contaminated needle, you were pricked, okay, the estimated risk of transmission is very, very low, 0.3% lang. So very, very low. So what happens if you are diagnosed with HIV? You should undergo what we call antiretroviral therapy. Yan. Okay, so in order to inhibit the viral replication. So it reduces the amount of HIV in the body, reduces the risk of HIV transmission, prevent HIV from advancing to AIDS, and protect the immune system. So this is your antiretroviral therapy. Remember, there is no cure for HIV. Instead, there is only treatment for HIV. Okay, so these are the classification of antiretroviral drug. Your nucleoside diverse, these are the drugs. Your non-nucleoside, these are the drugs. Your nucleotide diverse transcriptase inhibitor, your protease inhibitor, and your antifusion. Okay, so these are drugs. So we make use of combination of treatment for HIV. So you can give 2 of these and 1 of these. Okay, 2 of these and 1 of these. So usually triple drug in 1 tablet. Okay, so I want you to read this. These are the mechanism of actions of your antiretroviral. So it inhibits the fusion. It inhibits the transcription of RNA into DNA. It inhibits the integration of host DNA into the host DNA. It interferes with the assembly. So these are all the actions of your antiretroviral drug. So what are the action of protease? This one. Okay. So these are the side effects of your antiretroviral drugs. Okay, so methods of prevention. Okay, these are your methods of prevention. Okay, so diagnose all people with HIV as early as possible. Before you get the patient at early age, very, very hard to treat. Treat people with HIV rapidly and effectively. Prevent new HIV transmission by using your pre-exposure prophylaxis. Okay, so respond quickly to potential HIV outbreak to get prevention and treatment. Okay, so stop HIV, prevent, educate, advocacy support, and the risk is not knowing, get tested for HIV. So we have an HIV Act, Policy Act in the Philippines that the treatment for HIV is libre. Okay, antiretroviral drug is not to be bought, but this is given free. So prevention is better than cure, especially when something has no cure. Okay, so with that, thank you. Okay, so any question?
Doc, may question po ako.
Yes po.
Doc, pwede po bang maging basis ng treatment yung